Should you get filler in your face to look younger? In this video, I am telling you the 5 things that you need to know before you go and get filler. And you may be wondering if I get filler or what my opinion is of filler. I'm going to go through all of that in this video, but as a spoiler alert, I do not have any filler in my face now, nor have I ever gotten filler, and I'm going to explain why throughout this video. But as a board-certified dermatologist, I actually inject filler quite often into others who want it. Filler can actually be an incredible treatment with amazing results, but it's just not for me at all, at least not anytime soon. And if I change my mind, don't worry, I will take you along with me to show you the whole process. I'm Dr. Maren Locke, known here as the budget dermatologist. So here are the 5 things that you need to know before getting filler. Number 1, time out. Before you commit to getting filler, you need to truly understand what filler is and what it can and cannot treat. So number 1, understand what filler is and what it can do for you. So people often get confused about Botox versus fillers versus lasers or peels when they are trying to fix their skin concerns. So educate yourself first about fillers. Go to your injector prepared with educated questions. This will also help you vet the injector that you are seeing to make sure they are knowledgeable enough to answer your questions and make you feel comfortable. So fillers are for fixing volume loss in your face. They will plump the skin back up because you see, as you age, we lose fat from our face and we suffer from bone resorption as well. So it literally looks like our faces deflate and fall over time. So fillers are a substance that can be injected into the skin to counteract those changes. They will fill the face back up and lift it back up. So filler is this jelly-like viscous substance that is in a syringe. This is injected into the deeper layers of the skin with a needle. Now, most fillers are a synthetic form of hyaluronic acid. That is the most common type. Of course, there are other types of fillers, even some that are permanent. Before you convince yourself that filler is magical and will totally lift and plump your skin back up, you really need to understand this second point here. Filler correction on the face is subtle. It's so subtle. So number 2, filler changes are subtle. What does that mean for you? It means that if you want a significant amount of correction on the face or anything more than just a small tweak, you will need likely a significant amount of filler to notice a difference. So more filler equals more money. So how much is 1 milliliter in real life? That is literally a teaspoon. If you put this much into your cheeks, or this little into your cheeks, or you split a syringe half in one cheek, half in the other, for example, the degree of change that you can notice is extraordinarily small. So you actually may need multiple syringes to achieve the degree of improvement that you may be looking for. However, of course, location on the face matters. The lips, for example, are totally different. It is a much smaller area to work with. You can certainly overdo it easily without even much filler at all. So the pendulum can really swing the other way there. But in terms of plumping and lifting the face, just realize that 1 syringe worth of product will give a very subtle result if you are young, and it gives virtually no results significant enough if you are significantly more aged in appearance. You will need many more syringes to get a noticeable and acceptable result. And that brings me to number 3. Fillers are expensive. In fact, they are much more expensive than Botox. Although many price models exist, typically the most common ways these are sold is by the syringe, and a price of a syringe will range from $500 to possibly over $1,000 for just 1 syringe with 1 milliliter of product inside. And like I said, if you are looking for a certain degree of improvement, you may be looking at multiple syringes to achieve this result. So that is multiples of the price of a single syringe. So keep that in mind when you are budgeting. It's not just the cost of 1 syringe that you need to know, it's how many syringes you need to achieve your desired outcome, how long that result will last, and that is going to be your expected investment. Number 4, along the same lines as your investment, you need to know that these results from filler are temporary. You must continue to invest your money in fillers to maintain your result. Fillers will last anywhere from maybe 3 months to possibly 24 months in some cases. This will vary drastically depending on the type of filler used, the location it is placed in the face, and your own variables like how quickly you metabolize it. So fillers in the lips and the lower face, for example, will last a much shorter time than filler placed deeper in the cheeks, for example, because there's just so much more movement there from talking and chewing that the filler tends to really break down more quickly in those locations. So you can easily be looking at thousands and thousands of dollars per year to keep the face volumized at a certain level. Now, for this discussion in this video, I really am referring to hyaluronic acid-based fillers, which dissolve over time. These are not permanent fillers. So hyaluronic acid fillers are by far the most popular type, and they are much safer in general than permanent fillers. And lastly, number 5, you need to know that cosmetic procedures, especially fillers, are not without risk. So there are side effects that come along with fillers, and these are real and they happen and they can be detrimental. So you must know your risks and accept those risks if you are going to move forward with this procedure. Common side effects are pain at the injection site. Okay, duh. Needles being injected or poked through the skin of the face or the lips, it's going to hurt. There's just no way around that. Sure, you can apply topical numbing medication and that can maybe lessen the pain a bit, but you still are going to feel it. Now, it is tolerable for most people, and some filler is even mixed with numbing medication to help make it not be as painful, but you will feel it, and some people have a higher or lower pain tolerance than others. Another common side effect is bruising. I say to expect bruising. Plan for it, and if you don't get any at all, consider yourself lucky. Never plan to do a filler session before an important event, and the chance that you bruise, you want to give yourself enough time to heal. This can vary from person to person. I like to say in general about 2 weeks. But those common side effects are temporary and expected. So let's talk about things that are a bit more serious that can happen with filler, like arterial occlusion, which is probably one of the scariest ones. This means that filler is injected by accident into an artery or a vessel in your face, and it blocks the blood flow, so no blood can flow through it. And if no blood can flow through it, then whatever that vessel feeds will die. This can cause skin necrosis or skin death, and even worse, it can cause blindness that is permanent, because many of the vessels on the face or the head go to the eyes, and if those are the ones that are cut off, the eye can go blind. This actually happens. It's a very real side effect of filler. It is rare, but it's real. So you can minimize your risk of this by going to an experienced injector like a board-certified dermatologist and not injecting areas that are high risk on the face. But I will tell you, even if your injector is the most experienced in the entire world and does the procedure technically correct, the scary thing is that this can still happen to you because everybody's anatomy is different, and this is not an exact science. It's more of an art, a risky art. And what's even more important here is that if you are one of those unfortunate people that suffers this side effect, you need to make sure that your injector knows how to identify this problem immediately before it's too late, and knows how to fix it and has the correct supplies on hand to fix it immediately, because time is of the essence here. Oftentimes, this damage can be reversed before it turns permanent if you have the experienced injector who knows what to do. So when you pick your injector, do not choose them because of the lowest price. Choose them because of their experience. And as the budget dermatologist, I tell you when to spend and when to save. And this is one of those times where it is not best to pinch your pennies. Choosing based on experience will give you extra reassurance that if something does go wrong, your injector will know how to diagnose it and how to treat it immediately. So let's talk even more side effects. Fillers can cause granulomas or little lumps under the skin. These can create an unsightly look, they can be painful, they can create infection and other issues. Some studies are also linking fillers to autoimmune reactions. So if you are someone who has autoimmune issues, please discuss this in depth with your provider before getting your filler procedure done. And lastly, this is kind of a side effect or maybe just a consequence of the procedure, but you just may not like the outcome. After all that money and hassle, you may hate the end result. If a dissolvable hyaluronic acid filler was used, you can get it dissolved with an injectable medicine called hyaluronidase, which is a whole other expense and can of worms. So just because you make the investment, there is no guarantee that you will like the result or that it will meet your expectation. And last, a word of caution before going down this road of cosmetic procedures. This is like your unofficial number 6 thing that you need to know, perhaps the most important and kind of sad situation really. But repeated injection with filler over time can lead to significant facial distortion. So this means that a little tweak here and there with a syringe, maybe every quarter or every few months or just a few times a year, can slowly start taking you farther and farther away from your natural look, and not in a good way, in more of a strange way that can be kind of hard to even look at. We see this in celebrities, now influencers, and other dermatologists and injectors all the time. Changes from one visit to the next may be small, but over time they add up. So it is important to realize this and be extremely cautious before going down this road. The world of cosmetic procedures can be addicting. We see this all the time. It really just turns into this obsession for some people. So just keep your perspective and realize that you have other options. Anti-aging doesn't mean that you have to look like someone else or look exactly like you did when you were 20. That's not always the goal, and it shouldn't be the goal. I believe that anti-aging is a mindset where you feel good as you age and you love and accept your skin while trying to take the best care of it that you can. I always try to remind myself that aging is a privilege, so it's not just a look, it's a mindset. I think that we can all use this reminder in the current age of social media that there is not one ideal or standard of beauty. It's really easy to start to believe that when you look at celebrities and influencers online all starting to morph into this image where they all look the same and subsequently look nothing like their natural selves. It's just so weird and bizarre and unhealthy and obsessive. So yes, fillers can be a really great cosmetic treatment when they are done appropriately.